Good morning, everyone. Welcome to today's live update. I'm Chancellor Donde Plowman, and we're here to talk about what's been happening in the last few days related to COVID. We have seen a significant rise in the number of active positive cases. I am confident in our ability to manage through this, and I also want to be clear. We expected an increase at the beginning of the semester as we brought students back, and we are seeing it. But these increases also cannot continue unabated. Let me repeat that. The increases cannot continue. And it's going to take all of us to make sure that we bend that curve. This morning, we're going to talk about our rising case count, the strain it is putting, particularly the sudden rise, on what we're doing and what we're doing about the strain on the resources and what we need from everybody, every stakeholder that's part of this community. We will get through this, but we're in it together. So we have been getting a lot of questions related to Greek housing. And we will talk about why we are seeing clusters specific to Greek housing and how we're trying to address that. We have 7 clusters, and you'll see that in a minute. As a preview, it's partly due to the close communal living styles of those houses, which is what makes it an attractive living place for students who are a member of those organizations. We will spend the last part of today's update with Brian Browning, who is Executive Director of Auxiliary and Support Services. And he's going to answer some of the questions we've been getting about dining on campus. And as always, I'm really pleased to be joined by Provost John Zomchik and Dr. Spencer Gregg. So let's go over today's case count and isolation data. I remind you again, like I do every time, that this information is on the coronavirus website, and it is updated every weekday morning. So you are looking at the cases for September 3rd. Those cases reflect the cases we had at the close of business yesterday. So there you go. Look at that steep increase since August 31st. We currently have 369 active COVID-19 cases. 363 are students and 6 are employees. I want to put this in some sort of perspective because 1 week ago we had 153 cases. We have to stop that upward trajectory. The good news on this, the only good news on this graph is that our faculty and staff line is completely flat. So that's really good news. But we've got to work towards bending that curve and stopping the upward trajectory. I want to begin, Dr. Gregg, with you. In general, what are our contact tracers finding that's contributing to this sharp rise in cases?
Thank you, Chancellor. It's good to be with you this morning. In answer to your question, most of our recent positive cases still tie back to the events that occurred over the preceding couple of weeks, and it's primarily related to group gatherings, such as the large group gatherings that occurred off campus as classes got started, and now close contacts of those attendees who've now become positive. Several have also been associated with group activities such as bid day, where individuals may not have been practicing appropriate health and safety guidance. Many are due to other small group gatherings where individuals have been amongst friends or family, but they've kind of let their guard down, and several are related to some clusters that occurred in sorority housing. All these types of activities have contributed to the increased numbers, and it's really concerning, particularly with the Labor Day weekend upcoming.
So when we gather without our masks, we're gathering for social reasons and we want to be together socially, but we gather without our masks, we put each other at risk, and that's a large part of why we're seeing the increases. Let's look now at the next metric that we follow. We now have 1,647 people in either quarantine or self-isolation. And let me remind you, quarantine is they're a close contact. Isolation is they've tested positive. So if we look at that number, of those 1,647, 1,581 are students, and it's now about the same number on campus and off-campus residents who are in one form of quarantine or isolation. And again, the employee line is very flat and very low. An additional metric that we show is the clusters. So let's look at that for a second. We now have 7 clusters, as we mentioned at the outset. They're all in Greek sorority houses. And we define a cluster as there being 20 or more close contacts to a positive case that has been identified. So we will put this information in more context in just a few minutes. As these numbers continue to go up from here, it is beginning to strain everyone, and it's going to put a strain on our resources going further. So I want to talk, since we've got people on this call that are students, parents, faculty, staff, I want to talk to this large group about what we are doing to administratively to relieve some of that strain, as well as what we need from students, from staff, and from faculty. So administratively, we are about to secure an additional hotel that and we'll have it in its entirety that we can use as additional isolation spaces for people who test positive. We are also redeploying staff to support the added resource needs related to contact tracing, meal delivery, and transportation, as well as data entry and tracking to support students who need to quarantine and isolate. And I really, really, really thank the staff who have answered the call to be flexible. They're stretching their responsibilities, moving from one thing that they were doing into another area, and that's beyond their day-to-day work. So we will need to continue to call on staff across campus, and I know that people will step up as they already have. Also, we are working with our Greek houses and the health department to review plans and facilitate opportunities that will allow people in our Greek houses to quarantine and isolate in their houses as much as possible. We are encouraging them to put together plans where they can stay in their living quarters safely. And we're making progress on that. And I'm really hopeful about that. We're also looking at our dorms to consolidate vacant spaces to use for isolation spaces. This may require some students to move rooms. For some students, between quarantine and isolation, or moving to create more space, this may feel a bit like a semester in motion. It's not easy, but it's how we're going to get through it. So I think if people could just start thinking about that, we can make this work, but we're all going to have to be flexible. And students may have moved into one space and they may have to move into another. And if they contract the virus, they're going to move into another and then move back to their space. And I hope people can just begin to think about that's okay, because that's going to enable me to get my education this semester and for us to stay here together. We will get through this. We've also hired logistics coordinators to help make sure students who are quarantining and isolating have what they need and are getting where they need to be. So I want to ask Provost Zomchek. I talked a bit about what staff are doing. I talk about what students are going to need to do, and we'll say some more about that. How can faculty help students who are in quarantine or in isolation?
Thank you, Chancellor. I too am happy to be here with you this morning. I want to say at the outset that I can't praise our faculty enough for the work that they've been doing throughout the semester, excuse me, to continue to deliver the outstanding instructional experience to our students. They are all working very, very hard. The classes that they're leading have exactly the same quality as the classes that they've always led. They're just different. They're not lesser. So a big shout out to the faculty. Also realizing, as you said, Chancellor, that these are difficult times, but we will get through these. So here's some things that I'd say to the faculty, especially as we move through these middle weeks of the semester. Expect your students to sort of be a little more stressed as work piles on them from all of the classes that they are taking, and find ways to be accessible and responsive to your students. Hold virtual office hours. Let your students know how you will communicate with them. Be consistent. One of the things that's happening is so many things are changing in our students' lives, and so many of them have new things that they have to deal with, even small changes can be disruptive. So to the extent possible, stick to your syllabus, stick to the modality that you have chosen to teach in. Be trusting. Don't require absence notifications from our students. Just remember that a student who is required to quarantine or to isolate is dealing with yet another big change to his or her life. They don't need to have to run and get an absence notification. Trust them during this time. And finally, be flexible. Help students who might have missed classwork because they are quarantining make up the work that they've missed through giving them alternate assignments or whatever you think is appropriate. So I just want to emphasize again, I can't praise our faculty enough for their commitment to our students. These times are challenging to all of us, but I know we're going to make it through them with understanding, patience, and the compassion that we show to all members of the volunteer family.
John, thank you very much. And I can just add to that, as I'm teaching a class myself. It's small, it only has 14 students. We're spaced out in a big room. One student was missing last Tuesday night. And then we learned that he's in quarantine. So what does that mean for me? It means this week, I've got to make sure I got the camera on in there so that he can be part of it. It probably means it won't go as smoothly in my class as it normally would because the activities I had planned, I got to make sure he can be part of them on the screen, but we're going to do it. And I just think it's an example of, I know faculty are doing this all over the place. It also means that if I was grading myself already ahead of time on that class Tuesday night, it's probably not going to get 100. It's going to feel a little herky jerky, but we're going to do it. Right. And that's the kind of adapting I'm talking about. And I know it's happening everywhere. We did a lot of work over the summer to prepare for just these circumstances. Our faculty worked hard at thinking about, what am I going to do when a large proportion of the class are having to quarantine and can't come to class? But we said from the beginning that flexibility and creativity are critical to our success this fall. I just want to reemphasize, that doesn't mean we didn't do this correctly. It doesn't mean there was a mistake. When you adapt, it means you change to the circumstances that present themselves tomorrow. And they won't be the same circumstances that present themselves the next day. So I have confidence in our ability to manage these cases that we are seeing and keep our campus safe. We are going to be adapting, and we will ask things of people that we wouldn't otherwise ask. And I know people, volunteers, are going to step up and say, yeah, of course I have to do that. But we need to flatten the trajectory, the upward trajectory. And it's going to take all of us. So Dr. Gregg, from where you sit, what are some of the biggest challenges you've had over the last few days as director of our health center, person overseeing the contact tracing and all of that? What are our biggest challenges right now?
Well, I think our biggest challenges over the last few days have just been the large influx of positive cases. It's really been challenging to our frontline staff in the contact tracing program. Because of the large daily numbers, it's become a lot more difficult to move as rapidly through the cases as we had been doing. And being immediately responsive to contact by the contact tracers is also proving to be a challenge. We're having to do more phone tag, email tag with people that we're trying to get in touch with, and that just slows the process down even further. We do attempt to prioritize our contacts. So for instance, those that are positive and are noting that they have symptoms, we're going to be prioritizing those because if there's a problem with them, we need to know that so we can give them advice on what they need to do. And our goal is to move positive students to isolation as soon as we can. So anything that slows down that connection between the student and the contact tracer just draws out the process further. For instance, students going off campus to get tested and then not completing the self-isolation form has probably been one of our biggest complicating factors. Another challenge has been, just over the past 2-3 days, the number of calls and contacts that we're getting from outside to areas that are really trying to focus on carrying out these procedures. And we're just really respectfully requesting that you give us patience. Students, families provide patience to our staff. They are diligently working to address each and every case. And we just ask for your patience in that regard.
I want to go back to something you said. I'll just give an example because I hear these cases. I overhear calls that are coming to my office. So a student who gets tested off campus, and they call their parents and say, I've tested positive. And maybe they tested, they got the results back some days later. They then tell their parents, I tested positive. And then we hear from a parent that my son tested positive on me and no one's brought him any food. And then we go and look it up and we don't even know that he's tested positive. So I cannot say enough about, as a parent, the first thing you ought to ask them is, have you filled out that self-isolation form? Because otherwise, unless they get tested at the health center, and that's what we would encourage for all students. If you think you need a test, come to the health center. Because that just delays, it puts a big bottleneck in the system. Am I correct about that, Dr. Gregg?
That is correct. If we can get you seen through the Student Health Center and get tested, and we're ramping up more testing there as these numbers have continued to go up, because we obviously have more close contacts that are going to need to be tested. Then essentially we're going to tell you before you leave the Student Health Center, complete the self-isolation form. That way we know the contact tracers are being advised of your situation.
So let me just talk a little bit. I want to direct these comments directly to students. First of all, I want to say, by and large, most of our students are doing so well. They're doing exactly the right thing we're asking, and I appreciate it. But we just got to keep working at this. And to turn that curve, I'm going to say some things that I think we're at an inflection point to the students. And I want you to hear this correctly. Like right now, this weekend, I'm asking you to change your behavior if it needed changing. I want you to socialize small this weekend. In other words, just be with a handful of your best friends and keep your mask on. And if you can't keep the mask on, make sure that you're more than 6 feet away from them. Stay out of places that are crammed with people with no masks on, like bars that I see them out there myself. If people are crammed in there and they're not wearing their mask, you become a close contact of someone. And what your goal is not be a close contact. And you can do that by wearing your mask. If you don't have a mask, even if you do have a mask, staying distance as much as you can. If you do not have a mask, you should be not in contact with someone within 6 feet for more than 10 minutes. That makes you a close contact. So help us, please, get control of these numbers. So this weekend, do it differently. We need you, secondly, to fill out the self-isolation form. That is how we get you in the system. That's how we know you need us. Otherwise, we have no way of knowing. And our system gets backlogged because we could be talking to your parents about why we haven't gotten you food, and we don't even have you in the system. And we need our people moving through the self-isolation forms, getting to people who need it. So please fill out the forms. This is how we get you in the system. We can't provide you the instructions or the help that you need if you don't fill out that form. The third thing, use the Student Health Center for testing. We've heard, listen, the medical community is a small community. The ERs all around campus call us. Your students are coming here to get the testing because they don't think we'll tell you. I mean, that's what's happening. So do it here. We will find out, and eventually someone will call you, but you're several days into a situation where you could have, been in contact with lots of people, and we could have helped you isolate and get you what you need. So please do it through the health center. It'll make it go so much faster. And we have control over those resources and how quickly we can respond. We don't have control over when the health department or when some other agency around campus, how fast they can turn things around. When you quarantine in place, so if you fill out a self-isolation form, if you think you have been in contact with someone, quarantine in place until you get your results back. And then we'll give you other instructions. And quarantining in place means stay in your room, get grab and go, take it to your room, wear your mask when you have to leave the room. Be prepared in your room with at least a couple days worth of snacks, clothes, or personal items. If you have been tested and are kind of waiting, you can quarantine in your room safely, but just be prepared. And when possible, we will try to allow students, we know people don't want to be moving around. We're going to try to allow you to quarantine in the room. It's not always possible, but we're working with the health department and trying to make some accommodations to where that can happen. It kind of depends on the circumstances. So to the students, this is what we need you to do, okay? So let me just go back to Dr. Gregg for a second. Almost all the clusters we've seen so far are in Greek housing. Why is this? We're not seeing them in the dorms.
Right. The greatest issue with the sorority houses, and that's where the clusters have been showing up, is that they're houses, and houses tend to be smaller in size. They're more compact. They have smaller confined living spaces for a greater number of inhabitants than what a normal house would have. This type of space is great for socialization that it permits in those types of living situations, but it's less than optimal for infection spread and exposure. Also, the style of bathrooms that are in those houses are typically smaller, and they're probably the most contributing factor to why we're seeing the clusters in those areas.
So just speak a little bit. So I think you kind of got there, but dorms are different. And just say a little bit more about how dorms are different. So we're not seeing clusters out of the dorms. There are people who've gotten COVID who live in the dorms. We're not seeing the clusters. Just repeat that a little bit more.
Right. So again, the sorority and fraternity houses are actually more akin to houses, whereas a residence hall is more like a business space where people occupy a small space with a limited number of individuals throughout the day, and they happen to share a common bathroom at times. Additionally, in the residence halls, the living spaces are greater in size. Most of them are minimally accessible even at this point, and they're obviously less frequently used. A residence hall is less like a house and more like an apartment building. So that's why you tend to see clusters originating from houses more than you do facilities.
It has to do with that close communal style of living, which is a really attractive feature for living there. It's also attractive for the virus, is what you're saying.
Exactly.
So just one more question, Dr. Gregg. So what are other things we must do to get the numbers down?
Well, I think the main thing is that sometimes I feel like I'm the proverbial voice crying in the wilderness here, but it does go back to the basics. Avoid close contact with others, avoid being within 6 feet of others, and if you must be within 6 feet of others, make it for as short a time period as possible.
And have a mask on.
Yeah, wear your mask, especially in public spaces. Anytime you're going to be around other people, wash your hands. We tend to leave that one out, but that's key, washing your hands or using alcohol gel, covering your coughs and sneezes. If you're sick, stay home. Don't go to work, don't go to class. And always complete a self-isolation form if you've tested positive, if you're awaiting a test result, if you feel sick and have symptoms, if you know you've been in close contact with someone that's tested positive, then we need you to complete that self-isolation form. We can't help you if we don't know about your circumstances. And the only way we're going to know about your circumstances is if you let us know by submitting the self-isolation form.
So one more question. Could you say a little bit more about the out of doors? Why is it that all the health experts say the out of doors is so much safer for people? Could you talk a little bit about that?
It's just a matter of concentration of the virus that's in the air. And so, you've got wind, you've got wide open spaces, and there's just not as much concentration. So you're less likely to encounter a sufficient amount of the virus that you're going to become infected with it.
So one of the things students you are starting to see on campus is we've got tents and tables and chairs with chairs 6 feet apart. I encourage you to use that. I see you using the hammocks. If you're not using the hammocks yet, it looks inviting to me. I've ordered myself a hammock and I'm going to hook it up out there one of these days. But use the tents, use that space. Get your friends and go out under the tent and sit 6 feet apart and have some time together. So the out of doors is so much safer for everyone. And I can't emphasize that enough. And while we have these good months of warm weather, let's use them. So to everyone on the call, we are deeply committed to our students and to helping them be supported. So many of our students are just actively committed to becoming part of this community of volunteers. I see them all the time all over campus. It's going to take all of us. I want to just spend the last few minutes talking now about food, one of my favorite subjects, dining. And we have Brian Browning with us. And we've been getting some questions, Brian, about dining procedures. So let's talk a little bit about, I'm a student, I show up to get food, and it looks like there's a long line in there. What kind of adjustments are we making about lines in terms of getting food?
Thank you, Chancellor. So in preparations for the start of the semester, we introduced the new Get Food app, which has two components. The first allows students to make reservations at any one of our 3 residential dining halls, and students can schedule their preferred meal periods up to 7 days in advance. So to specifically address some of the issues of long lines right at the start of the semester, we added a 15-minute grace period to encourage students to reserve times other than on the hour. This has helped significantly by not having students show up all at once for particular reservation times, spacing it out more. In addition, the entry doors at all the point of sale locations are left open to allow entry for those arriving a few minutes before the reservation time, so they're welcome to come right on in. These 2 adjustments alone seem to have really addressed the backups we're experiencing. And then the second app component allows students to order and pay in advance at any of our national brands. Then they can pick it up at their selected time, and this allows them, of course, to avoid lines, ultimately providing them the flexibility on their time and ensures that we're doing the social distancing.
So both of those are examples of how we adapted by coming up with the app and serving food differently. And then once we saw we were starting to get bunches, we had to adapt again. And
Correct.
so I guess I want to just reassure folks on the call that as we see things not working, we will figure out what it is and make the needed adaptations.
Absolutely.
Brian, let me ask you a couple more things. Just in general, what are the challenges of serving food during a pandemic like this?
That's a great question. So probably the single most biggest challenge is reducing seating capacities. That's completely contrary to what we're all about. We're wanting to do the opposite and maximize our seating capacities in our dining facilities. So that's probably the single most challenge, but also maintaining sufficient personnel, just like all employers are having to do right now. Working with our food suppliers, which have experienced some delays in their supply chains. A large percentage of our dining team includes student employees and team members who have school-age children. So it's not just contracting COVID-19 and being a concern, but also facing the challenges of assisting children with virtual learning. In addition to preparing and serving in our dining facilities each day, we're delivering meals to our students that are in multiple quarantine and isolation housing locations. So this has obviously added an additional level of complexity as these meals have to be safely packaged, and we've needed to bring in additional drivers and delivery vehicles. Recently, we tasked our vol dining team who come up with what they've coined as a surprise and delight for our students who are in isolation housing, isolation and quarantine housing. So last week alone with their meal, when it was delivered, they got a water bottle and some hand sanitizer. And beginning next week, we're going to provide a loaf of pumpkin bread. And this is just a way of, Vol Dining's way of trying to make a difficult situation a little less stressful.
That's great. One last question. So just in sum, what is the best way for students to safely get a meal at one of our dining locations? What do you recommend?
I would say first and foremost, Chancellor, as you've continued to remind everyone, make sure to wear your masks when you're not eating and practicing social distancing, which includes not moving any of the dining furniture. This is difficult for all of us, but I recognize it's even a bigger challenge for students who are just excited to hang out and eat with their friends. And then second, use the app as it's designed to keep you safe while providing you flexibility with your ongoing schedule. Our dining facilities are safe. They undergo continuous cleaning daily. In fact, I frequent all of our dining locations, not just to ensure our practices and protocols are being followed, but I eat at the locations every week.
Okay, that's great. So firsthand knowledge. Well, thank
Yes.
you all. Our time is about up. I want to thank everyone for your time today. We are managing through. This is a difficult rise in positive cases. And a number of our students in isolation, out of our 30,000 plus students, You saw the numbers today. We're over 300 in positive new cases. We can get these numbers down. I know we can, but we've got to work at it together. And it's hardship for every single one of us. And probably in some ways, especially for our students. I want to also say the same thing I said on Tuesday. One of the ways we'll get through this is with an abundance of grace. And I'm asking people to be generous with grace. We're all in this together. We're working at it. We won't get every single step correct, but when we continue to work at correcting every mistake that we've made, if we have, and try to make things better. So I thank everyone for their attention, their efforts. I thank all the students for the way so many are adhering to what we need to do. And we're going to get through this, and it's going to be different. Students may be moving around a little bit more than they want to, but this is volunteer country. This is Tennessee. And we're looking forward to a great fall, and let's go Vols and start thinking about September 26th. How's that? When we beat South Carolina. Thank you all.